So with lip filler, the number one most important advice that I have would be that you need to go to someone who is a licensed professional. This is something that they've had years of experience, injected hundreds of patients. That's the most important aspect in terms of choosing an injector, but also, am I going to have migration? So migration can be from the product. I've also even seen it in patients with autoimmune diseases. But usually if the patient is injected appropriately in the right plane, the chance of migration is much less. There is a product that we have that's called hyaluronidase, and it does break up hyaluronic acid. So the only FDA-approved lip fillers are hyaluronic acids or squishy gels. So if they do migrate, we are able to inject the product, and that helps break down the hyaluronic acid. So if it does migrate, there are treatments, but most importantly, if you go to a licensed injector who, look at their before and after photos, look at their reviews, the chance of having a problem is much less. But like anything else, there is always a chance. It's a risk of migration, and we can deal with it if that's what happens. But you just want to go to someone who also can reverse it if you do have migration. So the largest complication of any sort of filler, but most commonly with lip filler, is intravascular occlusion. This is why it is so important to find an injector who has years of experience. Look at their reviews, look at their before and after photos. You want to make sure someone has a ton of experience injecting filler. So what intravascular occlusion means is exactly what it sounds like. The filler is injected into a blood vessel. Now, there are ways to reverse this, and it's almost always reversible if it's noticed immediately. So there's clues. Usually it's a blanching of the area. Sometimes it looks like a severe bruise. When that is noted, there are ways we can dilate the blood vessel. So if you're inject into the blood vessel, we don't want to contract the blood vessel. We want to dilate so that product, it moves through the blood vessel. So the ways to do that: heat, there's nitric oxide paste, even just manipulating the area. If that doesn't work, we can inject patients with hyaluronidase, which does break up the hyaluronic acid. And then I would want to monitor the patient probably for 30 minutes to an hour afterwards, just to make sure we don't have any problems. I would recommend going to a physician or a physician-owned and operated medical spa. One thing we occasionally see is you can purchase, I believe they're called lip pens. It's essentially like a stamp, and it's like doing lip filler yourself at home. This can also cause an intravascular occlusion. If you do have an intravascular occlusion, it will cause facial necrosis. Its only treatment, it would be debridement and then hyperbaric oxygen therapy. So you do not want to utilize some of these at-home fillers, or go to someone who's, doing this out of the back of their car or their basement, who has no medical training. There are wonderful physicians, nurses, nurse practitioners, physician's assistants, but it's, very important that you go to a licensed professional with years and years of experience.